Hello and welcome to State Matters. I'm your host, Matt Muratore. If you like fishing, if you have health insurance, this is the show for you today. Joining me is the president of the Fishing Partnership, JJ Bartlett. JJ, thanks for joining me.
Oh, my pleasure. It's great to be here.
So we always start the show as learning who our guests are. So if you could tell us a little bit about who you are.
Sure. I'm JJ Bartlett. I am the founding president of Fishing Partnership Support Services, and we're a nonprofit that improves the health, safety, and economic security of commercial fishing families.
Okay.
We've been around for about 20 years. I have a wonderful wife, Jessica, who's a researcher. She studies programs and services that help children, and we have a couple children of our own. Molly, who's a junior in college, and Jake's a senior in high school.
Great, great. And where'd you grow up?
I grew up down in Connecticut on the shore, and
Okay.
came up here to go to college at Harvard, and haven't left since.
Okay, and what did you study at Harvard?
I was a biology
Okay.
major, yeah.
Is that your degree?
My degree is in biology,
Okay.
and then I went on to Boston University and
Okay.
got a master's degree in business with a concentration in healthcare management.
Okay. And what did you do after you came out of BU?
Well, so while I was at BU, I heard about this group of fishermen who were getting together because they were really interested in access to healthcare services. And so halfway through the program, I started working with them on that, and they haven't been able to get rid of me since.
What made you want to get into healthcare or healthcare plans?
Oh, I don't know. It's probably similar to why you get into government. There's a bug I had, and it's just a clear and need that people have. Every family has, and it's great to be able to earn a living and help people.
Yeah. And you live in Acton right now.
I do.
So you don't even live on the shore.
I know. I miss living on the shore.
But you deal with fishermen.
Right. But
why is that?
Well, there's we work with fishermen up and down the coast, and so we had to plant ourselves somewhere in the middle.
Like you said off here, we can't live in Gloucester, and it will, make the people in New Bedford unhappy.
Exactly.
Or vice versa.
Exactly.
Yeah,
We've got to be a neutral party.
Yeah. So tell us about the Fishing Partnership Support Services. Tell us what you do.
Sure. Well, as I started to say, we improve the health, safety, and economic security of fishing families, and we support fishermen because they really deserve our support. I mean, no one knows that better than the people who live down here in Plymouth, where we're filming. They're heroes who go out to sea and risk their lives to bring us food. They've been stewards of the oceans. I mean, again, here, literally since humans settled the area, they've been feeding us and taking care of the oceans. And in Massachusetts, there are 7,000 fishermen. Down here in the South Shore area, there are about 1,300 fishing families.
Oh, wow.
And what's really cool is that allows Massachusetts to have a seafood industry that's a multi-billion-dollar industry. So we're talking about 90,000 jobs that depend on our fishermen to pull the fish from...
In the Commonwealth?
In the Commonwealth.
Wow. Now, you started this in 1997.
Yes.
And what made you start it? What was, why? Were there a lot of uninsured fishermen at the time? Or?
Well, another reason we support the fishermen is sadly they need our support. You can imagine it's a very difficult job on your body. You get banged up. In addition, they are... the fishermen are dependent on forces that are outside of their control in order to earn a living. So, for example, the price of fuel, the catch, whether or not their engine might blow one day, and that's incredibly stressful. And so fishermen are actually you could see it in their healthcare outcomes. They're actually sicker. They're more likely to smoke. They are more likely to die on the job. They're more likely to be uninsured. 5 times more likely to die of an opioid overdose than any other worker in the country. Wow. And so what we do...
Why do you think that is?
Well, it's due to a number of factors. It's incredibly difficult work. They are going out in very harsh conditions. And thankfully here in Massachusetts, we have fishing industry leaders who are actually not just state leaders, but they're national leaders. People like Ed Barrett, John Havland, Todd Jesse and the Jesse family have been community leaders for generations. And
all from this area.
Exactly, yeah. And back in the mid-90s, a group of fishing leaders were getting together, and they wanted to address one of the main issues. They're all these rugged individuals, but that means that they don't have the support of a corporation taking care of them. They don't have a human resources department taking care of them. So they knew they wanted to start an independent organization, which became Fishing Partnership, that could fill that role. And so back then, the most clear and present need was for access to healthcare coverage. This was about 10 years before the statewide reform.
I was going to ask you about that, how that affected, but go ahead.
Yeah, exactly. So that's why I was interested in healthcare and getting folks access at the time. And having grown up on the shore, I knew, okay, if you can cover fishermen, you can cover anyone.
Yeah.
This is an incredible model. And having the idea come from the community itself was really, really impressive. So we started a health plan that was a demonstration project for what came later. And we did a lot of the same things. We grouped the fishermen together to get a market competitive rate and provided sliding scale premium structure. So if they had a good year, they'd pay more. But if they had a tough year, they'd get more subsidy. And we ran a health plan for 15 years, and we reduced the rate of uninsured fishermen by 75%. Then state reform came along, and we knew we could
That was the mid-2000s, right? That came along,
exactly.
The Romney Care.
Exactly.
So how did that affect this?
Well, so what was great is we no longer had to be an insurance company ourselves. So we could broaden our mission and sort of become a human resources agency for fishing families, and that allowed us to do so much more.
And then more recently, the federal government, the Obamacare, how did that affect this, or did it affect it at all?
Yeah. So what happened? I guess. It's a good time to take a step back and talk about our model, because just as important as what we do is how we do it. Everything that we do is through the community. As I started to say, the idea was born out of the community, and we're here because we have an office right on 139 Court Street in Plymouth. And
oh, you are? Okay.
Yeah,
okay.
Yep. And we have offices in Gloucester. This is the down in New Bedford. This is the 18th year in a row that New Bedford is the largest port in the country. And down in Chatham as well. And all of those...
Chatham as well? That's interesting. Okay.
Yeah. And all of those offices are staffed by members of the fishing community. We call them navigators. So, in every community, really in every family, there's someone that we all go to when we're sick or when we need help. They're the people who, when someone's ill, they make sure that they get a ride to the doctor, or that people are bringing them, delivering food to them. I know that you're one of these type of people. Your staff, are these type of people. Well, some of them don't have jobs, and some of them are in the fishing industry. And if you find them and train them to do the work that they're pretty much already doing anyway, it turns out to be a really powerful community health model. So we have these navigators here in Plymouth. It's Lori Karen. And
so she runs the office in Plymouth?
Exactly.
Okay.
She runs the Plymouth.
Is it like a Monday through Friday?
Yep.
Or?
Yep.
Okay.
Yep.
Okay.
And but she can be reached anytime too.
Yep.
All of her information is on our website. We can give that number later.
Sure. Yeah.
But since when healthcare reform came in, we still, while we don't have to be an insurance company ourselves, our navigators are still trained by the federal and state governments to help people sign up for coverage.
So it's just people in the fishing industry that would come to the office to sign up, or whatever questions they may have, et cetera.
Yeah, so we exist to help the people in the fishing industry.
Yep, okay.
But I'd love to tell you more about that. But just before I go any further, too, we consider coastal communities fishing communities.
Okay.
So if anyone needs help, we'll help them with any of our services. So if anyone listening or watching needs help with healthcare coverage, they should absolutely feel free to stop by any of our offices, and we'll help them with coverage.
So they don't have to be in the fishing industry. industry, but what sort of help would you give them?
Yeah, we help people sign up we help fishermen sign up for coverage. We help them choose what plan might be available to them. It's interesting. Here's another way that you asked why at the beginning. Why is it more difficult for fishermen? Here's another way where it can be more difficult to be a fisherman. Their incomes fluctuate dramatically from year to year, and even within the same year.
And in seasons too.
Exactly.
Yeah.
So I don't know if you heard, there's an interesting story recently about one sushi grade bluefin tuna just sold for $3 million.
I did hear about that.
Now,
yeah.
And I would have liked to.
Why was that so expensive? I couldn't figure that out.
Well, it was big and really,
yeah.
really high quality, I guess. But and that's clearly unusual. But it's not unusual for tuna to sell for tens of thousands of dollars, even hundreds of thousands of dollars. Well, the reason I bring this up is you can imagine there can be fishermen who can leave the shore on Mass Health, catch a fish, return to shore, and they're not eligible for Mass Health anymore. So we help them, and you don't get into fishing because you love filling out forms,
Yeah.
So we help them figure out what coverage is best for them. We help them sign up for that coverage, find a doctor that's near them, maybe a doctor who speaks their language. We've been working with the connector this year to make sure that everyone knows the penalties that might be levied on them if they don't have coverage. And then also, helping people sign up for the other programs through the connector, like dental coverage. And then there's Mass Health and Medicare and unemployment. And, we'll help people sign up for their spouse's coverage if they have questions. Just basically anything to keep people insured.
I was going to ask you why are they called navigators, but I think I understand that now. They're really helping these folks navigate through the real maze of health insurance.
Yes.
Whether it's private or whether it's government funded. And that's probably one of the top questions that we get asked a lot of times in our office is about health insurance, particularly Mass Health and how it works and the connector and all that. So
absolutely, and we'd always welcome the opportunity to be a resource for you.
Yeah, I want to just digress for 1 second because this is kind of impressive. You were actually named 40 under 40 in 2008 by the Boston Business Journal. Tell me about that. And congratulations on that.
Thank you. Yeah. Well, sadly, you're dating me.
Yeah, that was over 10 years ago, but still, it's impressive.
Yeah, thank you. It's really, I think, a tribute to, I'm because of the interesting work that we do, and I basically accept the award on behalf of the people we work with. We started with signing people up for healthcare coverage, but our model is to listen to the navigators about the needs that are in the community. They know what fishing families need because they're from fishing families themselves, and they know how to meet the needs because we train them to be community health workers. And so they're able to tell us that, there are a lot of vessels that are going down, and the families are, that impacts the families, obviously not just at the time, but for generations when they lose people at sea. And so we've been able to, for example, build a relationship with Riverside Trauma, so we can bring a trauma team in to support the families. We can bring fishermen access to dental cleanings, immunizations like flu shots and tetanus shots, all things that independent workers like fishermen don't have access to because, like I said, they just don't have human resources departments like other groups.
Are you seeing a lot more issues with behavioral health, mental health services as well, more so than maybe before when you started?
Yes, so there's an example. So I mentioned at the outset that fishing families are fishermen are 5 times more likely to die of an opioid overdose. And it's a perfect opportunity to talk about that a little bit. And you can imagine, we already said that fishermen go out, they do incredibly difficult work in a harsh environment. So they get banged up, and we know from our healthcare days that the rates of back pain, neck pain, arthritis are all off the charts. You would expect that. Well, like I said, independent workers, they don't have access to vacation days or sick days. So if they don't work, they don't get paid. And if they don't show up for work, they might never get asked to go out on that vessel again. So there's tremendous job insecurity. So of course, they're working through pain. Of course, they're working through injury. And of course, doctors are prescribing painkillers so that they can do that. Well, now we know that 4/5 of all new heroin users started with prescription drugs. And so that's how you end up having one of the highest death rates in the state. Well, what's great is having people on the ground in the community to recognize this allowed us to address it early. So we've been doing Narcan trainings. Last year alone, just here in Plymouth, we've done over 50 CPR first aid and Narcan trainings so that the fishermen have that life-saving medicine available on their vessel when they go out to sea. Not only for the fishermen, but also they're often the first responders for recreational fishermen and other boaters, because you know, ambulances don't really go where fishermen fish. And we're able to also run lots of other opioid awareness programs. We have, and we're starting support groups that are run by fishermen, for fishermen. So it's, like I said, the key is just having the people who are navigators who are right there on the ground in the communities.
How many folks in your organization?
We have about 20 people in the organization right now.
And you talked about the training that the navigators go through. Well, what's sort of the training that they go through? So they're trained as community health workers. So they learn how to they learn all aspects of care. They're also trained by the state to be healthcare navigators, so they have aggressive. So there's a state program that actually does the training?
Exactly. So there's a state program that trains them in the intricacies of health insurance and how to sign people up for health insurance. We provide them additional training in things like psychological first aid, so that after a tragedy, they're able to support them. And it's really, the model's working really well. In 2016, we were named the Community Health Worker Program of the Year.
Oh, congratulations, that's great. And where does your funding come from?
We get funding from the state, is the primary source. Is
it out of Mass Health, or is it?
Yeah, out of yes, it's through Mass Health, and we're able to use the funding not only to sign up people for health insurance, but also to run programs like our safety training programs. We actually have one coming up here. We have a couple programs coming up. In February 15th, we have a program running out of our Plymouth office for CPR and first aid. And like I said, of course, we'd love fishermen to come, and anyone's welcome. And then we have a safety training program on March 21st and 22nd in the South Shore.
Oh, great. I also, as part of the research, we found that you actually were, after you got that 40 Under 40 award, you were invited to talk to the White House Office of Health Reform to testify on rural health issues. Can you talk about that a little bit?
Sure, yes. You know, as I was saying, independent workers have it, they're in a unique class of their own. And so fishermen certainly fit in this category. And some of the things I mentioned make it really difficult for them to sign up for healthcare coverage and to stay covered. Well, there are other groups like loggers, ranchers, farmers, who have a lot of these similar issues. In addition, the model of having people from the community, and, you know, instead of having some health policy nerd like me go out and tell them what they need to do, having this model where everything starts with them saying, this is what we need, can you help us? It turns out to be a really effective model, as I mentioned, and that's something that can, particularly for these independent workers and workers that are hard to reach and in rural areas.
There was one more award that I thought stood out too, and it was in 2017. You got a leadership award from police. What's the connection there? Fishermen and police.
Well, the connection is through our opioid work. So we have some of our navigators are trained as certified recovery coaches, and so after after an opioid overdose, there are many police departments that will go out into the households and not try to put anyone in a legal jeopardy, but just to talk to the families and see if they have the resources they need. So our navigators have joined those ride-alongs, and so they'll go with the police to the families, particularly when there's a fisherman involved. But often not, often not, just as a community resource. And they're able to then follow up and help people if they need to step down from inpatient to outpatient care, or if they need to find a group to go to, or get Narcan training, for example.
Okay. What other services do you provide?
One of the things that I'd love to talk about is our safety training program. So in the last week alone, are you familiar with the show The Deadliest Catch? It's a
Oh, sure.
Sure,
Yeah,
sure.
yeah,
Well,
yeah.
sadly, one of the vessels just capsized and 3 fishermen died this week. And at the same time, closer to home, a boat capsized, and there are 2 fishermen who are missing off of Block Island. Fishermen here in Massachusetts are 40 times more likely to die on the job than other workers. And some of that is due to the fact that it's dangerous work, but a lot of it is because there aren't the resources or training available to fishermen, because the rules are different out at sea than on land, so they don't have access to safety training. So our fishermen took it upon themselves to go get trained as Coast Guard authorized certified trainers, and we run these days-long programs where with it's not classroom, it's hands-on training where we light fires and they practice really putting them out. They get in survival suits, light flares, and we've put about thousands of fishermen through this training. It's only about 25% of all fishermen, but
Why? Why is it? Why won't more do it?
it wasn't available until recently.
Okay.
And so we're just, it's just taking the time. But
Of course, they don't get paid to get trained either, though, right?
well, that's it. They have to take a day off work.
Yeah.
It could be that there's it's been a bunch of windy days. They haven't been able to fish, and the day you have your training's the first, day that they can go out and fish. But I have to say that between that and some of the other programs that we're running, I just don't want to miss the opportunity to say thank you to you. And none of this would exist for fishermen if it wasn't for your work. And we have such a blessing here in Massachusetts to have an active, working, caring, bipartisan government supporting workers like the fishermen. And so we owe just a huge debt of gratitude to you and the governor and the legislature. I mean,
Well, I think, as you brought up in the beginning, I think we realize how important they are to our life, to our lives. But the jobs that are created, being on a coast, it's huge to us.
Yeah.
What they bring to the quality of life for everyone in the Commonwealth and beyond.
well,
So,
I greatly appreciate
So we have
it.
to be able to give back to them and help in any way we
Yeah,
can.
and for me, it means that the people, my friends, our families, you're saving their lives, and so we really appreciate it.
And so how far out do they actually go in the seas? I mean, is pretty far out they go, and are they in federal waters at that point?
Yeah, it's interesting. Yeah, so we have an incredible. So first of all, we're so lucky here in Massachusetts. We have the most highly regulated oceans in the world due to the regulations that we've been under. So if you eat a locally caught fish, it's guaranteed sustainable because of the laws that we have in place. But yes, and we have a real diverse fishery. So there are some fishermen like clammers and other shell fishermen. They don't leave the shore at all.
True.
Lobstermen may go out for a day, and then we have fishermen who go out for some weeks.
I didn't think of that. So you are doing people that are actually on shore, like clamming and all that too.
Yeah,
so that's
absolutely.
true too. Yeah.
So that's why we have to have all sorts of different services.
Yeah. But when they get out in the federal waters, is there anything different that? that they have to do, or
There
any
are
other training, I guess is what I'm trying to get at?
Yeah, absolutely. The longer that you spend out at sea, there are programs that are specifically designed for that. So, for example, man overboard trainings, or how to get in your survival suit real quick, because you don't have a lot of time out in those waters before it gets real dangerous. It's one of the families that just went through our trainings. It was a father and a son and a daughter went through our training, and they went through our training on Thursday and Friday. On Saturday, we got a call from the daughter and said that her brother wouldn't be alive if it wasn't for what they had just been through. His leg got caught in the rope as the lobster pot went overboard, and it dragged him over. And in the first minute, I don't know if you've ever done one of those, in the middle of winter, jump in the water, but it's a shock. It knocks, it knocks it's surprising, and a lot of people at that point inhale, and they can drown right there in the first minute. And if not, you have about 10 minutes before your muscles stop working, and if you're not wearing a flotation device, you can drown way before hypothermia kicks in. But this 18-year-old did everything right. He had on his flotation device. He kept calm. He inflated it. His dad did everything right. Kept his eye right on him. Circled around, used dad's strength, pulled him in on board. And when you think about that, I mean, first, now there's an 18-year-old who has a career ahead of him. He's, bringing us lobsters for his whole career, bringing us tax dollars for his whole career. And also, it means that the Coast Guard didn't have to spend hundreds of thousands, maybe millions of dollars searching for him.
Yeah.
So these trainings are so crucial.
Yeah, thank God, yeah. Well, we only got a minute or so left, but tell us about the future. What are some plans for the future?
Well, so we are going to, we have a population that's aging right now. Some of the leaders are getting a little older, so we want to really start building out some of our business planning services. So planning for retirement, planning for, signing up for Medicare. We also, estate planning, things like that. At the same time, we're working with the state to build apprenticeship programs so that these older fishermen can teach the younger fishermen who are coming into the industry how to mend nets and where to stand on the vessel and make it safe, and some of the, the things that they've learned over generations. So those are a couple of the new things that we have.
So there is a need to bring more people into the industry then?
Absolutely.
Do you know the average age of a fisherman at this point?
Right now, the average age of the fisherman is 55. It's older and it's aging.
Yeah,
At the same time, that's been true for a little while. But what's really cool now is we're seeing a bump of younger people. We just had a safety training last year where we had 50 fishermen and the average age was 26.
Excellent. That's great. That's great. What's your website for people at home watching?
Fishingpartnership.org. And yeah, please come on, check out what we do and sign up for a training.
Great. JJ, thank you so much for
My
joining
pleasure.
me. We hope you enjoyed the show today. I want to thank Ben and Keith back at the studio here for putting this on, and we'll see you next time on State Matters. Thanks for watching.